pananaw at opinyon ng pag-uulat ng mag-uulat sa programang ito ay hindi ang pangunahing posisyon o pahayag ng pamumunuan ng organisasyong ito. The views and opinions expressed in this live report are those of the presenter and do not necessarily reflect the official policy or position of the management of this organization. Okay, ladies and gentlemen, good evening to all and Happy New Year. Welcome to our first Magpayo Tayo Kainklusyon episode for this year. Today is Saturday, January 8, 2022. I am Carlos Miguel Kanahashi and together with me is Asher Santos. Christian Chan will be joining with us in just a moment. And for our technical team, Sir Mark Betita as well. And we're broadcasting simultaneously on InkluRadyo and on the Hands in Inclusion Philippines YouTube channel. Opening remarks, Asher?
Hi, good evening po ladies and gentlemen and Carlos, and welcome po sa ating unang Magpayo Tayo Kainklusyon na yun 2022. Yun ang magiging topic natin for today, for tonight is about the Omicron variant. Christian Chan will be joining us later po, together with Sir Mark po. Thank you po, Carlos.
Okay. We shall commence our presentation in just a moment and we will be back after these commercials.
To our first.
Now this.
Ayan, tagal naman yun.
Good evening, everyone. Sorry,
Clinical
didn't register right.
search.
Didn't register right just now. So,
Okay. Hi, Christian. Welcome back. Happy
welcome,
New
welcome. Thank
Year.
you. Happy New Year.
Happy New Year.
And before I start the topic, I want to say na I'm afraid of turning old in 4 days.
Okay, anyway, guys, welcome back to Magpayo Tayo Ka-Inclusion. So this evening, ladies and gentlemen, we will discuss to you our topic for tonight, which is about the Omicron variant. So when we say Omicron variant, what is the variant? What is Omicron variant? What is the origin? What are the reported cases of this variant? What are the researches involved in that variant? How did Omicron variant spread to our country? And what are the ways and how can we prevent ourselves from this variant? So without further ado, here now is our topic for this evening, the Omicron variant. So what is Omicron variant, ladies and gentlemen? So Omicron variant, ladies and gentlemen, is a new variant. This is another variant of SARS-CoV-2, which is the virus that causes COVID-19. It was first reported to the World Health Organization from South Africa on November 24, 2021. So Omicron variant is a new variant which is likely spread more easily than the one that was discovered in Wuhan, and also how it's easily spread compared to Delta, which is the previous variant which had a surge here in our country last year. So on November 26, 2021, the WHO designated the Omicron variant a variant of concern. Omicron is the 15th letter in the Greek alphabet. So, according to a statement issued by the World Health Organization, ladies and gentlemen, the Omicron variant was first reported to the WHO on November 24, 2021. The epidemiological situation in South Africa has been characterized by three distinct themes, which is predominantly the Delta variant in the reported cases. So, based on the evidence presented indicative of the detrimental change in the epidemiology of COVID-19, WHO classified this Omicron variant a variant of concern, ladies and gentlemen. Next slide, please. To read the origin, I will give the floor to Christian Chan and his explanations. Christian, the floor is yours.
Okay. So, thank you. So, Omicron was discovered in November 22, 2021 in Botswana and South Africa. Um, and it was first collected in South Africa on November 8th. As of last year, December 16, it's spread in at least 80 countries, or at least 50, or at least let me almost half of the United Nations members. So by mid-December, who detected it na it has been spread throughout the world. That's how I explain it.
So, ladies and gentlemen, based on the origin of Omicron variant, ladies and gentlemen, the Omicron variant was originated from both Botswana and South Africa.
Hmm.
But let's have a review, ladies and gentlemen. Before all the variants have came, answer this. Where did the coronavirus disease 2019 spread? What country? The
Um,
original variant, the original COVID-19, which was discovered last 2020, when before it became a pandemic. What country?
Wuhan, China.
China.
Where in China, Christian?
Wuhan.
China
Wuhan.
in Wuhan.
Wuhan, China. Doon nagsimula yung coronavirus. Actually. Mark, tanong ko sa'yo. Saang bansa nagsimula yung coronavirus? Mermic, please.
Sa China po.
Tama. Bago yung Omicron variant, nagsimula yung coronavirus disease 2019 sa Wuhan, China. Actually, discover nito nung late November to December 2019 kasi at that time, may unidentified coronavirus na nagsimula sa Wuhan. So, that's why ang itong coronavirus disease 2019, based on the origin, it was originate from Wuhan. And the transmission of this is tao sa tao. Ito, tao sa tao. Human to human transmission. And also yung SARS-CoV-2. And that's why, because of this, on January 30, 2020, the World Health Organization declared this outbreak a public health emergency for international concern and later being classified as a pandemic on March 11, 2020. Why? Why did the WHO declare the COVID-19 as a public health emergency for international concern and a pandemic last January 30 and March 11, 2020? Why? Christian, you go
Okay.
first. My answer, then Asher, and then you, Mark.
Okay, not to be political here, as MTK is neutral. But I think it's because of the responsibility of tourists that travel across to and from China. Not to get political, but I think I think China would be responsible for tourists coming in to and from China would be responsible. I mean, it's not their fault. I mean, they didn't know that something was amiss. So when they spread it to other countries through flights, that's when it all started. So in
Tama.
case I may have hurt someone, I may have hurt someone, I apologize.
How about you, Asher? Bakit niniklara yung WHO yung coronavirus bilang isang public health emergency for international concern and a pandemic noong January 30 at March 11, 2020. Bakit?
Because po kasi nga nakakahawa na po na tayo hindi lang po sa China pati buong bansa na po lahat na nagkakasakitan na sila. Kaya nga before po nag-start yung vaccine po ay ano siya mahahawa na tayo sa lahat po buong bansa na. Marami ang natigil po dahil sa sa virus na yan. Yun.
How about you, Sir Mark? Tanong, ito, bakit ang WHO diniklara yung coronavirus disease bilang isang pandemya at ang isang public health emergency noong January 30 at March 11, 2020? Bakit?
Dahil po mabilis po siya nagsuspread sa ano sa sa katauhan po. Mabilis po kumalat. Kaya po nila dinideklara po yun.
Tama
If I
yan.
may add, if I may add, Carlos, and to think the Philippines was reeling from the Taal volcano explosion that happened just a few days before. I
Tama
can
yan.
remember clear because it happened on my birthday last 2020.
Opo, para hindi siya direct po sa sa pagtama ng mayon ng Taal no 2 years pa ago pa. Hindi
Yeah,
siya direct.
I get it, Asher. Pero we've already we've already started wearing a bit of face masks here in Manila at before because of the ash from the volcano. And then once it lessened, it mask restrictions came back up again because of this one.
Because of the COVID.
Yes.
That's absolutely right. So anyway, that's to the discussion of the confirmed cases or the reported cases. Next slide, please, Sir Mark. So, Asher, can you explain these reported cases, please?
Okay, on November 25, one confirmed cases were identified in Israel from a traveler returning from Malawi, along with two who returned from South Africa and one from Madagascar. All four initial cases reported from Botswana occurred among fully vaccinated individuals. Then on November 26, Belgium confirmed its first case, and an unvaccinated person who had traveled from Egypt via Turkey on November 11. All three initial confirmed and suspected cases reported from Israel occurred among fully vaccinated individuals, as did a single suspected cases in Germany. On November 27th, two cases were detected in the United Kingdom or UK, another two in Munich, Germany, and one in Milan, Italy.
Bakit, Asher?
Oo, yung traveler po sabi po hindi siya vaccinated sa para something yata ta, ta, para hindi mahawa sa sakit po. Then the following day, na-compare yung cases in Belgium po. Yung isa namang unvaccinated person po. So, hindi ko lang kung ano yung hindi siya na-vaccinated sa yata. Then the next day naman ay yung may bago naman cases po dito sa Europe po mismo.
Okay. Next slide, please, Sir Mark. Okay. So, on November 28, there are some cases of Omicron variant confirmed. 13 cases were confirmed in the Netherlands. They just arrived from South Africa. And they also followed 5 cases of Omicron variant on the same flight from South Africa to Amsterdam. Entry into the Netherlands required having been fully vaccinated or RT-PCR tested or recovered because of the newly imposed restrictions, after which 61 passengers tested positive for SARS-CoV-2. In Australia, both people landed in Sydney and they traveled from South Africa to Sydney via Doha. The 2 people who were fully vaccinated were isolated. 12 other travelers from South Africa also entered quarantine for 14 days, and other 260 other passengers and crew of the flight have been ordered to be isolated. Two travelers from South Africa landed in Denmark tested positive for COVID. It's also on the same day of the Omicron variant being detected in the Netherlands. On the next day, on the same day, alongside Netherlands and Denmark, Austria also confirmed its first Omicron case. A detected Omicron case was reported in Czech Republic from a traveler who went to Namibia. Canada also reported the first Omicron cases, with two travelers coming from Nigeria and becoming the first North American country to report an Omicron case. Next slide, please. Can you read this slide and explain to this, please, Christian?
Okay. November 29, Darwin, Australia had its first covered case, and the person from in that arrived from Johannesburg, South Africa, the day 4 days before. Again, two more from Sydney because two more from Sydney from South Africa by Singapore. Meanwhile, Portugal reported 13 Omicron cases, and Sweden also confirmed their first case on November 29, and Spain. All of them came from South Africa. The next day, Netherlands reported that Netherlands reported that there were two more cases. Another one in Sydney because from a traveler who visited South Africa, and Japan also had this first case. Two Israeli doctors also tested positive, and despite this, they even though they're vaccinated. And in Brazil, three more cases of Omicron. So in short, most of the sources of the cases we've seen come from South Africa. But that doesn't mean South Africa is the root cause. Um, what's good about South Africa is that they discovered the cases because they have all the medical laboratories, all most advanced medical laboratories are in South Africa. So it's not right to say that South Africa is the cause. South Africa discovered this, and by unwittingly, unbeknownst to people, it spread. It's not really their fault. It's not really their fault. Are they? I think they're all vaccinated. So all at this point, it's already. I think they're already vaccinated. So I think the I think I am not sure what to say at this point. But one thing I do know is that you can't blame South Africa for starting the virus, this variant.
Okay.
We can but congratulate them for discovering it so that it helps us be more prepared. Now, here's my. Is it okay if I make a short excursus?
Okay, sure, sure, sure.
Here's my take. The reason why we skipped from Delta to Omicron is because if you think about it, there are actually more variants being discovered. But none of them, like you have the Lambda variant. You've heard of that before, right? The Lambda variant? No.
Yes, the one that's
Okay.
originated from Peru.
Yes. Now, the reason the you have because there are 24 letters in Greek alphabet: alpha, beta, gamma, delta, epsilon, zeta, eta, theta, ka, theta, iota, kappa, lambda, mu, nu, phi, omicron, pyro, sigma, tau, epsilon. Okay, I'm not gonna bore you with the Greek alphabet. Anyway, there's a lot of variants being discovered, but we only discuss the delta, lambda, mu, and omicron. It's because those four have already been majorly reported, and those four are what you can say have different concern levels that should be warranted by the entire world. But there are actually more variants than this.
Okay.
There's a recent one that's being called IHU. It's discovered by the International Hospitals University in France. Just to add. Anyway, I digress.
Next slide, please. Okay. Asher, ito.
Wait na, tagal pa ba?
Ito.
Next slide. Okay.
Basahin mo yan.
Okay. When a virus is circulating widely and causing numerous infections, the likelihood of the virus is mutating increases. The more opportunities a virus has to spread, the more opportunities it has to undergo changes. New variants like Omicron are a reminder that the COVID-19 pandemic is far from over. It is therefore essential that people get the vaccine when available to them and continue to follow existing advice on preventing the spread of the virus, including physical distancing, wearing masks, regular hand washing, and keeping indoor areas well ventilated. It is also crucial that vaccines and other public health measures are accessible everywhere. Vaccine inequality leaves lower income countries, many of them in Africa, at the mercy of COVID-19. Well supplied countries must urgently deliver the doses they promised for.
What does this mean in other
Oo,
words, Asher?
Oo, yung virus po ay nasi-spread po hindi lang po 'pag lumalabas tayo, yung lalo sa mga unvaccinated din ng tao po na nasa lumuhan po yung new variant po ay ano, ay malayo-malayo sa pinagayan natin from year ago po.
Okay.
Ay,
Based on this slide, ladies and gentlemen, based on the findings and researches, it suggested that Omicron is less severe than Delta, but more data is needed, and the WHO warns that it should not be considered mild. It is important to remember that all variants of COVID-19 can cause severe sickness or death, including Delta. That is why preventing the spread of the virus and reducing your risk of the exposure to the virus is so important. And based on the research, ladies and gentlemen, studies are ongoing and this information is updated when it's available. My question is on the next slide. How is Omicron variant spreading quickly or rapidly than any other variants? Based on the information, WHO believes that Omicron will outpace the Delta variant where there is a COVID-19 transmission in the community. However, being vaccinated and taking precautions are critical in helping to prevent the spread of the disease. And we all know these actions have been effective against other variants. So, ladies and gentlemen, Omicron is so rapidly spreading than other variants. It will replace the Delta variant. That's why we need to be vaccinated, avoid crowding in spaces, keep your distance from others, wearing a mask, and washing your hands and proper hygiene is very important. Next slide, please. Christian, ito.
Okay, this is a good question. Are COVID vaccines um where is it? Effective against the Omicron variant? So right now, researchers are trying to look at how this variant would affect COVID-19. So we still don't know, and the more information they're still searching. It's still searching, but so far the current vaccines right now would be significant against the severe disease and death. So at least they are still effective. So that's why you should be vaccinated against the currently existing variants, and always make sure to get the full 2 doses if you need to get the full 2 doses.
Okay. So, so next slide, please. Asher, can you read this next slide, please?
next slide, okay na. How can I talk to my child about the Omicron and other COVID-19 variants? The news about COVID-19 and now the Omicron variant is flooding our daily lives, and it is only natural that curious young children will have questions. Lots of them. We are some pointer to keep in mind, tips for helping to explain what can be a complicated topic in simple and reassuming terms.
What does this mean?
O pag-usapin natin sa mga bata po, lalo sa mga unvaccinated po, po ng mga kabataan po about sa Omicron, pati sa COVID-19 virus. Lalo na hindi na pinagbabawal na ulit lumabas sa mga mga kabataan na vaccinated sa COVID-19. Danay sa kakatakot po talaga. Ngayon dito po
Okay.
talaga.
Next slide, please, Sir Mark. Okay. So, children have the right to know what's going on, but it should be explained in an age appropriate way. In other words, know what's happening in the world today. Invite your child to share what they have heard and listen to the responses. It's important to be engaged, fully engaged, and to take any fears they have seriously. Be patient. The pandemic and misinformation can cause lots of worries and panic, that and also uncertainty for all. Also check updates from the WHO and their other health departments about the pandemic. And also, you should be up to date on the information. In other words, be updated. Next slide, please. If you don't know the answer, don't guess. Use this as an opportunity to explore the answers. Kids can take their emotional cues from adults. So even if you're worried, try not to overshare because they might end up being uncomfortable. Ladies and gentlemen. Next slide, please. Uh, Christian, this part, please.
Okay. We still have a lot to learn about Omicron. So, and it's still ongoing, it's still spreading. Many countries have thankfully established ways to curb the spread. But as we know, it is Omicron it's expected to outcompete in terms of spread. But thankfully, countries are finding ways to curb that variant.
Okay. So let us discuss what are the differences between Omicron as well. Next slide, please. Okay. So, ladies and gentlemen, Omicron is more transmissible than Delta. It will likely become the predominant variant in most cases. What is less known is that it makes it more transmissible and how rapidly it rises to dominance around the world. One concern is that more than 30 of the mutations of the Omicron variant are on the virus's spike protein, the part that attaches to human cells. Several of those are believed to increase the probability of an infection. So part of its enhanced transmissibility may come from its ability to evade some immune responses, especially those who are not vaccinated and previously infected. Early reports from South Africa showed cases rising rapidly from 300 a day to 3,000 a day over a 2-week period. So what does this mean, ladies and gentlemen? Guys, here. Yung in South Africa, ladies and gentlemen, because of the Omicron variant, look, try to analyze this data. I'll share my screen first. Try to analyze the data. Guys, tingnan mo yung curve ng South Africa. Oh,
Okay.
first wave, yung
Mm.
second wave. Ito yung third wave. At ito pa yung fourth
Fourth
wave.
wave, yes. We can
I think because of
yes.
the Delta. Omicron pala to.
Hmm.
Ang South Africa naman, it's the active cases of South Africa based on the research from the South African government. Try to check this data. Based on the update, it says there, wait lang ha.
Go. I can
Okay,
take
wait
it.
lang. So based on the Based on the cases of South Africa, okay. For South Africa naman, it's based on the cases, yes, as of today, despite the presence of the Omicron variant, active cases, okay, for South Africa, based on the statistics of coronavirus there, here, look at this number carefully. South Africa is 3.5 million active case overall total of the cases. With deaths, 92,000. Recovered, 3.2 million. What does this mean? Based on the curve, what does this mean? Ito yung first. Apat na tong wave na to. Kung tinitingnan ninyo to ng maigi, ito. Ayan o, tingnan nyo. Apat na wave o. Ito, bakit apat? Mark, tanong. Guys, analyze this carefully. Bakit ganito ang wave ng South Africa dahil sa Omicron at ibang mga variants? Try to check it carefully. Bakit? First wave, second wave, third wave, fourth wave. Kung
Tourism.
napapansin, bakit?
Tourism.
Bakit?
Simple as that. Tourism.
Tourism. Ikaw,
Yes.
Mark,
Tourism.
tanong. Bakit ganito ang curve ng South Africa? First wave, second wave, third wave, fourth wave. Bakit?
Dahil po nagiging ano po sila, nagiging kampante po ang mga tao doon. Ba't po nag-short na po yung bumaba na po yung trend ng COVID, bigla po sila nagiging kampante kaya po nagkakaganyan. Kaya po aakit na naman po ulit.
Sige. In the case of the Philippines, tingnan mo, yung magiging Philippines. I think this is the Omicron. Para Omicron yata to. Tingnan mo maigi. Yung Philippines, ano?
Grabe.
Bakit ganito yung Philippines? Yung curve. Bakit? Look at this.
Dahil po masyado po tayo nagiging kampante.
Tama yan. You're How about you, Christian and Asher? Based on the curves of South Africa and the Philippines, bakit ganyan? Once I showed.
Okay, in the Philippines, why?
Yes.
Tourism.
Ganon pa rin yung
Tourism.
South Africa. Tourism din.
Tourism.
Inikuro. Lalo na. Okay, anyway. Let's move on. Okay. Let's go back, ha. Ito. Next slide, please. Ito. Asher, ito.
If you further experiments compare these findings, they could suggest a less dire future for the pandemic. In short term, Omicron is expected to create a surge of cases that will put a massive strain on economies and healthcare systems around the world. But in the longer term, the new research suggests that an Omicron dominant world may experience fewer hospitalizations and deaths than one in which Delta continues to rage. Omicron is likely to push Delta out, said Alex Segal, a virologist at the South African Health Research Institute in Durban, South Africa, who led this new study. Maybe pushing Delta out is actually a good thing. And we're looking at something we can live with more easily and that will just burn us less than the previous variants po.
Okay. Next slide, please, Sir Mark. Ito. So, independent research and scientists said that the results of the South African experiment were sound. Based on the findings, from Carl Pearson of the London School and Hygiene and Tropical Medicine. He said, Omicron arrives and grows rapidly, and the Delta trend was declined. Meaning, na-decline ang Delta variant. Pero, naging inilungsa din yung isa pang variant, yung Omicron. Next slide, please. Ito, Christian.
Nathan Grubel, an epidemiologist at the Yale School of Public Health, said he was observing the same pattern connecting attack. That's self-explanatory. So while Delta cases fall, Omicron rises. So Omicron rises. So we know that that also confirms that we know that Omicron is spreading faster than Delta. And those who got infected with coronavirus before have already begun the bodies of those people who have infected with coronavirus before have already begun preparing themselves for future variants. So getting reinfected is rare, much less actually.
Tama yan. It's absolutely right. Okay, next slide, please. Okay. When the Omicron variant emerged in November, it rapidly spreads faster than Delta. Based on the researchers, they said that they had two sources. It can transmit quickly, replicating the large numbers, or by spreading more easily from person to person. Omicron can infect vaccinated people and those who got sick based on the past variants, Alpha, Beta, Delta, Lambda. In an earlier study this month, Dr. Segal's team, as well as a number of other research groups, confirmed the ability of Omicron to dodge antibodies from the vaccines and other variants. To do so, they analyzed blood from people who were vaccinated or recovered from COVID and mixed it with the other variants. So, next slide, please. So, time and again, ladies and gentlemen, antibodies that were very potent against Delta and other variants did a poor job against Omicron. This helped to explain why so many vaccinated and previously infected people were coming down with the bouts of Omicron, albeit milder than Delta. Kasi ang Omicron ay mas masyadong di gaano konting nakakahawa kaysa sa Delta variant. So, next slide please. So, based on their new study, si Dr. Sigad at yung kanyang mga kasamahan ay nagkaroon ng parehong eksperimento. Pero yung ang layunin nito ay kaugnay sa nakagumaling sa Omicron. South Africa has just gone through a huge spike of cases. He and his colleagues have so far able to study 13 patients. He said, this is very difficult because of the holidays. Nobody really wants to stick around and be part of a study. It's also possible that Omicron simply roused the existing immunity of the volunteers, provided either by vaccinations or previous infections. If that's true, then it remains to be seen what will happen to the unvaccinated people who will get infected with Omicron as well. So, in the next slide, ladies and gentlemen, Sir Mark, to discuss about how did the Omicron spread to the Philippines, I will give the floor to Christian Chan.
Thank you. Now, meanwhile in our country, how did we discover this Omicron? Different government agencies reported the detection of 7 cases and 10 cases of Omicron. Some of them came from other countries. Most of them came from other countries, and they arrived via returning flights to the Philippines. Next.
So, based on the detections there, The 7 important cases include returning overseas Filipinos and a Malaysian national. 3 of them arrived from the US via a PAL flight what TR-127 and TR-103 last December 16 and December 15 last year. Next slide please. Asher ito.
So, two arrived from the United Kingdom via connecting flights of Singapore Airlines Flight SQ910 on December 15 and Emirates Airlines Flight EK332 on December 9. Another case arrived from the United Arab Emirates through Philippine Airlines Flight 659 on December 19, and the seven imported case came from Ghana through the connected flights of Qatar Airways Flight QR930 on December 14. The husband of the four Omicron cases previously announced is among the seven cases. Two of the three local Omicron cases from the Bicol region, while the other is from the National Capital Region. A 42-year-old male who tested positive on December 3 and was tagged as recovered on December 17. The two Bicol region cases have already recovered too. A 27-year-old female who tests positive on December 40 and a 46-year-old female.
Next slide please. Ito. So, DOH confirmed on December 15, 2021, reported the first cases of the Omicron variant, which was arrived from the one is a 48-year-old male arrived from Japan through PAL PR427, and another one from Oman Air flight number WY843. So, next slide please. Okay. In a public announcement, Carlo Nograles, the acting presidential spokesperson, said the IATF, or the Interagency Task Force for the Management of Emerging Infectious Diseases, decided to shift to to, an, to a more stringent alert level status as the country saw a spike of the coronavirus disease 2019 infections. That's why alert level status in NCR was raised anew from Alert Level 2 to Alert Level 3, which was started recently from January 3 to 15, 2022. It was announced on New Year's Eve, ladies and gentlemen. Next slide, please. To discuss this, if you guys know this, Christian, your part, can you read this?
Okay. Malacanang assured that those who violate protocols would be prosecuted. And he made this statement because of Gwyneth Chua. If you remember the case, I think it'd be fine to drop the name since it's been reported around the news. She returned from the US, breached quarantine protocols, and tested positive for COVID-19 after being seen at a bar. So he reminded that regardless of if you're coming from abroad, be responsible to follow the quarantine measures around the Philippines, because if you don't, you would be you would suffer the consequences.
Okay. So according to what Carlo Nograles said, ladies and gentlemen, all the possible sanctions violation of the Notifiable Diseases Act, violation as prescribed as doon sa mga agreements natin with the quarantine facilities and isolation facilities, they have signed it and they know the possible sanctions they could face. Next slide, please. Asher, ito.
Yung Republic Act 11332 or RA 11332 mandates the cooperation of everyone in a public health crisis. That is our contribution. Think of our frontliners who put their lives on the line while your simple but important role in the crisis. When an individual does not self-quarantine in case of infection, he or she may be liable under Section 9, paragraph of the Republic Act 152 for non-cooperation of persons and and titles that should report and or respond to notifiable diseases of health events of public concern. Any person entirely found to have violated Section 9 of this Act shall be penalized with a fine of not less than 20,000 pesos but not more than 50,000 pesos, or imprisonment of not less than 1 month but not more than 6 months, or both such fine and imprisonment at the time of discretion of the proper court.
What does this mean?
Oo. Yung sa RA112 po ay dapat ma-cooperate po tayo sa public health crisis po para matulungan po. Dapat hindi siya yung kung sino yung hindi siya magsa-self quarantine po, baka ma-liable siya. Tapos mumutahi pa or kulong po mismo. Ano pa?
Sir Mark, tanong. Bakit isinabatas ang Republic Act 11332 based on this slide?
Para po magkaroon po ng disiplina mga tao. Para po malesen na rin po yung pagkalat po ng virus.
Tama yan. That's absolutely right, ladies and gentlemen. That's why a Republic Act 11332 was passed in order for us to show that we're protecting ourselves from any sickness. This is done for our safety and for our protection as well. Next slide, please. So to read the prevention measures, I will give the floor to Christian Chan based
Okay.
on this slide.
So, I'll read from this slide because I'll read from this slide na. How so do you prevent COVID-19? First of all, wash your hands. Because it is the most effective means of preventing all virus infections. And you need 20 minutes. It takes 20 seconds to wash for proper and thorough washing of hands. Next, practice proper cough etiquette. Cover your mouth and nose when coughing or sneezing, and move away from people when coughing. Do not spit. And when you use tissues, throw them away properly, and always wash your hands after sneezing or coughing. And after you use your hands, use alcohol and sanitizer.
Next slide, please. Christian, continue.
Okay, what else? Maintain 1 meter social distancing, and especially with individuals who are experiencing respiratory symptoms. Do avoid unprotected contact with farm or wild animals, animal markets, and products that come from animals. Ensure that food is well cooked. Use mask properly and when necessary. Check your temperature every day. Avoid large crowds. Never touch your face and get vaccinated. So practice social distancing. Practice practice safe healthcare and handling, and always get that vaccine, that COVID vaccine. It will save your life.
And also, just to add, ladies and gentlemen, also proper hygiene, cleaning of our surroundings, and of course, taking a bath as well. Dapat nga laging tayo maligo at paglilinis ng ating kapaligiran as well. Ladies and gentlemen. Ano pa guys? Ano pa ang mga prevention aside from that? May gusto kayo pandagdag? Asher?
Wala pa po. Wala pa naman.
How about you, Mark? Ano po ang pandagdag aside from this, meron iba pa mga preventions?
Lagi pong uminom po ng vitamins and maintain your good health po.
Kumain ng sapat.
Yun po.
And also, as I discussed about in the webinar ng UST about championing inclusion in the healthcare, I discussed about that yung also get vaccinated so that we can achieve herd immunity. If you want to, how can you get vaccinated? Check the schedule of your local government units regarding the vaccination schedule. And then, you can either register it in your barangay or you can do it online registration. And then you have to bring all the necessary requirements as well. The vaccination cards are both issued by the national and the local governments. Meaning, this will be used when we, as every time we go abroad or when we go travel domestically. That's why we need to bring those. And I remember in the news, ladies and gentlemen, if you remember yung main, ngayon yung uso-uso na yung fake vaccination cards. Bakit? Bakit meron mga ganyan? As I saw about sa peking vaccination cards. That's illegal, ladies and gentlemen, yung fake vaccination cards.
Mm.
Kasi, why? Vaccination cards is a government property. Tama ba yan, guys?
Yes.
Bakit?
Tama po yun.
Bakit? Based on the news doon sa Caloocan, I watched that already. Sa Caloocan City, hinuli yung mga taga-NBI sa isang gumawa ng peking vaccination card. Bakit? Sir Mark.
Dahil po illegal po yung mga ginagawa po nila, hindi po maganda. At imbis po na makatulong po sila, lalo po nilang palalalain po ang sitwasyon natin.
You guys agree?
Mm.
Yes.
Yes.
So that's why get vaccinated is very important so that we can achieve herd immunity. So that everything will all be back to normal. Sana all, ladies and gentlemen. Okay. Next, Asher, to read our summary, let's give the floor to Asher Santos.
Okay. The Omicron variant likely will spread more easily than the original SARS-CoV-2 virus, and how easily Omicron spreads compared to Delta remains unknown. Then first identified in Botswana and South Africa in November. The Omicron variant has surged around the world over the past few weeks, faster than any previous known from the coronavirus. And the Department of Health urged all private and public health workers, especially at the municipal, provincial, and barangay levels, to report all public health threats and emergencies to the Department of Health or DOH to continuously promote the welfare of the notable as mandated under Republic Act 11332, otherwise known as the Mandatory Reporting of Notable Disease and Health Events of Public Health Concern Act.
So that's why we need to, the reason why the Omicron variant is likely spread because this is because it's a new variant that was detected in South Africa, ladies and gentlemen. And now, in relation to our topic, before we wrap up our show, we'd like to thank you to to Lady Jane Floreset. Good evening to you and thank you for watching.
Pwede pa
And-
extend ng 10 minutes po to give way for announcements po talaga.
Sorry po, we're almost running out of time, Asher. 'Cause we
Next
need-
time,
Yeah.
next Saturday na lang.
Sige,
Off
sige.
na lang ko.
Mm.
Sige. So, to Lady Jane Flores. Also, Asher, thank you as well. So, before we close our show this evening, I'll share screen. Let's all read together and let us recite together this very important prayer that we are in this, especially in this time. So let us, before we wrap up our show, let us read together the Oratio Imperata for protection against the COVID-19 pandemic. Let's all read this together. Sir Mark, ito. Merciful
And compassionate Father,
Father, we
we
come
come
to
to
you
you in our need to seek your protection
protection
against the COVID-19 virus that has disturbed and even claimed lives.
lives. We ask
You now to look upon
look
us
upon us
with love and by your healing hand, dispel the fear of sickness and death,
in death,
restore our hope, and strengthen our faith.
strengthen our faith. We pray,
We pray that you guide the people tasked to find cures for the disease and stem its transmission.
We thank you,
Thank you for the vaccines developed, made possible by guiding hands.
Bless
Let's
our
start our
effort
efforts to use these
to use these
vaccines
vaccines to end the
to end the
pandemic
pandemic in our
in
country.
our country. We pray for our
Pray for
health workers that they
sorry,
may minister to the sick
seek
with
with
competence
confidence
and
and compassion.
compassion. Grant them
Grant
health
them health in mind and
mind and
body.
body, strength in
Strengthen their
their
commitment
commitment,
to protection from
protection from
disease.
the disease.
We
We
pray for
pray for
those
those afflicted.
afflicted. May
May
they be
they be
restored to
restored to
health.
health.
Protect
Protect
those who care
those
for
who care
them.
for them.
Grant
Grant
eternal rest to
real
those who
rest
have
to those
passed
who died.
away. Give us
Give
the
us the
grace
grace
in
in
these
these
trying
trying
times
times to
to
work
work for
for
the
the
good
good
of
of
all
all
and to help those
and
in
to
need.
help those in need. We
May our
are
concern and
concerned and
compassion
compassion for
for each
each
other
other.
see
See
us through this
us in this
crisis
crisis and
and
lead
lead us to
us
conversion
to
and
conversion
holiness.
and holiness.
Grant all these
This
through our Lord Jesus
Lord
Christ,
Jesus
your
Christ,
Son,
Son,
who
who
lives and
lives
reigns with
and reigns
you
with you
in the
in
unity of
the
the Holy
unity of the
Spirit,
Holy Spirit, God,
God forever and
forever
ever.
and ever. Amen.
Amen.
We fly to your protection, O
Protection
Holy Mother of God.
from God.
Do not
Not
despise our
despise our
petition
petition in our
and our
necessities,
necessities,
but
but
deliver
deliver
us
us
always
always from
from
all
all
danger.
dangers. O
O
glorious and blessed
glorious and
Virgin.
blessed Virgin. Amen.
Amen.
Our Lady, health of the sick, pray for
Pray for
us.
us.
Saint
Saint
Joseph,
Pray
Joseph,
for
pray
us.
for
pray
Pray
for
for
us.
us.
San Rafael,
Saint
Arcangel,
Pray
pray
for
for us.
us.
San Roque,
Pray for us.
pray for us. San Lorenzo
San
Ruiz,
Lorenzo,
Pray for us.
San Pedro Calungsod,
Pray for
pray for
us.
pray
us.
for us.
I hope you guys are safe at this time. So, Asher,
Then,
before we wrap up our show, what is our final words for the day?
then let's see.
Ano ang final words for the day, guys? Ako, for me, dapat palagi tayo mag-iingat and also follow the health and safety
Kaya pala
protocols as
telepono
well.
si ano.
How about you, Christian Chan?
I wish everyone a safe and blessed 2022. Stay safe and stay at home when you pass, whenever and whenever, whatever you can, wherever and whenever you can.
How about you, Asha? Anong final words natin for the day? Asher? Sir Mark, final words. Please.
Keep safe po. Lagi po kayo mag-iingat at susunod po lagi sa patakaran. Huwag po matigas po sana ang ulo natin lahat para po matapos na po ito.
How about you, Asher? What's your final words? And our New Year's message on behalf of Hands in Inclusion. Asher. Hello, Asher.
Ay, okay na. Okay na.
Asher,
Oh,
so anyway, before we go, Asher, can you have our final words and our New Year's message
okay.
of Hands in Inclusion,
Okay
please?
po. Thank you po sa pagsama sa amin sa Magpayo na kay Joshua. Sorry po dahil sa mahaba po yung topic natin po at wala na or sa pag no, hindi natin inini po para para hindi na tayo humingi ng permit to extend po. And the time consistent na naman tayo. Next Saturday naman po magbagit lahat po. Pero yung kanina po ay nabagit na yung sa ano sa sa one inclusion like kanina po earlier po. Yun po. Pati tomorrow po. May tomorrow naman po.
Okay. So, Asher, ano po ang mensahe sa mga nanonood about the Omicron variant and
Opo.
mag-iingat tayo?
Of course, please, wag na tayo lumabas po kung hindi po kailangan. then mag-vaccine na kayo, magpabakuna na yung sa mga unvaccinated po para hindi po mahawa-hawa po. Then dito na sa bahay po. As for me po ay ako sa sakit po talaga po noon last week po sa New Year po.
Okay, and also, ano po ang New Year's message natin? And our New Year's resolution for us here in Hansen Inclusion.
Here po, we wish you all a happy New Year to all po. Please be safe po and sana buwaba na yung COVID na yan po at may pababa natin sa alert level po para maligtas naman ligtas po ang mga tao po.
Okay, guys. So, and also to Colleen Gloria, good evening po and thank you for watching. So, anyway, wala na po tayong oras. We're already running out of time. We're running out of time. We'd like to thank everyone for watching our first Magpayo Tayo Kainklusyon for 2022. I hope you guys learned something from this. This episode. It will be premiered on the next day on the YouTube channel of Hansen Inclusion Philippines. So again, continue to be safe and healthy. So on behalf of InkluRadyo and Hansen Inclusion Philippines, I am your host, Carlos Miguel Kanahashi. Together with me is Christian Chan, Asher Santos, and Sir Mark Betita for our technicals. Saying, may the Almighty God bless us all and pagpalain nawa tayo ng Diyos ng poong may kapal. I'll be back again tomorrow for our special report at 5:30 in the afternoon. All together, again, Happy New Year and
Happy New
Happy New
Year
Year po sa ating lahat and
Happy New Year!
Happy New Year po. And all together,
HNI. God first.
God's first.
Thank you very much for watching Magpayo Tayo Kainklusyon. Good night, everyone, and bye for now.
Happy
Bye-bye.
2022.
Bye-bye.
Have a safe 2022.